Public and private health sectors use this time to strengthen pregnancy education and stress important issues that promote healthy pregnancy and safe motherhood. Pregnant women are encouraged to start attending antenatal care as soon as they suspect that they are pregnant, and certainly within their first trimester. To give us more insight to the pregnancy education, we are joined in studio by Yasheen Moodley, doctor, who is a gynaecologist. Thank you so very much for joining us here on Morning Live.
Morning, Leanne. Morning, viewers. Thank you for having me. It's a pleasure.
It's an absolute pleasure. Now, we talk about pregnancy education. I mean, obviously, this is a very crucial issue. How crucial is it?
I think it's absolutely crucial in today's modern world. Pregnancy is such a profound, life-changing experience, and it offers both rewards, but is at the same time a lot of challenges.
Yeah.
And I think by preparing or planning for pregnancy, one can actually take control of certain factors that they can and minimize factors that they cannot. A holistic approach to pregnancy will afford one the chances of having a safe pregnancy, an uncomplicated delivery, a healthy baby, as well as good breastfeeding.
Yeah, which is all vital. I mean, all of those points are vital. But, you know, how does one ensure that you're safe during your pregnancy?
I think in order to deal with that question, one needs to just break it up into the pre-pregnancy and the pregnancy part. Pre-pregnancy, there's a lot of personal issues that one needs to view initially. I think readiness for the responsibility of a pregnancy, the age of the particular parents, financial status, seeking professional help, emotional support when needed. I think to look at the career adjustments and at the same time to talk about shared views when it comes to certain aspects of parenting, such as discipline, religion.
Yeah.
I think maternal health is also fundamental, especially the father's maternal health doesn't really so much influence. It does, but to a minor role. I think from a maternal perspective, their chronic health, certain conditions like diabetes, hypertension, certain infections like HIV, these are the sexually transmitted infections, your herpes, your syphilis, all play a role in pregnancy. The non-sexually transmitted infections such as rubella, chickenpox, chronic medication, the use of alcohol, smoking, recreational drugs.
Everything comes to an end.
Genetic disorders, nutrition, fitness, exercise, and particularly the role of folic acid in pregnancy.
Yeah. Let's talk about South African women in general. How healthy are we as a nation when it comes to pregnancy and women carrying in South Africa? Because yes, we can have a look at women who have the ability to go to a private hospital, go to their gynecologist, go for regular checkups, but what about the average South African that cannot afford that? How is the health on that side?
I think from the public sector, I think they are trying to make a difference. I know currently, I used to work at Baragwanath Hospital. I think women are getting more than one scan. There are trained fetal medicine specialists to assist them with the relevant scans to determine abnormalities, genetic testing. The antenatal clinics have become much more informative, discussing issues, giving talks on breastfeeding, the use of condoms, especially for sexually transmitted infections, the role of vitamins, folic acid. I think it is ongoing, and I think they are trying. It may be to a smaller extent than what we have in the private sector, but I think they do give it a fair shot.
Okay, so it is improving.
It is improving.
Good. Well,
I don't think
is
so we'll
important.
reach the private sector as yet, but also the private sector has its limitations.
Yeah, indeed. Just in terms of underage pregnancy as well, I mean, that's a massive issue here in South Africa. How do we deal with something like that?
I work in the private sector, so I also get to see a lot of teenage pregnancies. I think the young woman is not so informed about contraception, and I think that's where it starts initially. A lot of the pregnancies that I see are actually unwanted pregnancies as a result of incest or rape. But I think the way they handle it, the emotional support that they get from their families is vital. It is an issue that I try to address personally. So if I see the mothers or the grandmothers, I try to influence their input on their children's lives. I think there is also quite a big intake in the public sector to deal with contraception.
Yeah.
And I think knowledge is power, and we are reaching some people, and I think most people. I think you do get to see it also in the private sector, that they are aware of their actions, and they know that it was probably a mistake, and it's actually, they could have done something about it.
All right. I wish we could talk for longer. Unfortunately, running out of time. Dr Yasheen Moodley, who is a gynaecologist, talking to us about Pregnancy Awareness Week here, and just some of the successes around how South African women are progressing in pregnancy and how to look after yourself during pregnancy as well. Thank you for being our guest on Morning Live.
Thank you very much for having me.